Hey guys, Doc Hepps here. So have you heard about these kind of neat testosterone pellets that you can get placed under the skin a few times a year and you don't need to do injections or gels? Well, I'll give you the scoop. Stay tuned. Hey guys, it's Doc Hepps here. So the question is, what's the deal with these testosterone pellets that you've heard about that can be placed under the skin a few times a year? What's the good, bad, the ugly? And stay tuned for the end. Well, I'll give you my thoughts on how these things work. So testosterone pellets come in different forms. The prescribed form are called Testopel, and they're pellets that are long-acting forms of testosterone supplementation. In men who have low testosterone, these are an option for testosterone replacement. So the other ways to replace testosterone include gels, there's injections, there's pills out there, there's nasal sprays, and there are these pellets. And again, these pellets are little small tic-tac size tubes that are impregnated with testosterone. So from a practical standpoint, what do? Well, we would lie you down on your belly. We clean off the skin kind of your buttock area in the fatty tissue on the side of your buttock below your belt. And we numb you up real good, and we make a little nick in the skin. We use a special tube that slides a number of these pellets underneath the skin into the fatty tissue, and then we usually use a little Band-Aid or a little dissolving stitch and sew that little skin nick up. Whole procedure takes probably 5 or 10 minutes. Usually most men take some ibuprofen or Tylenol, and they feel fine within a couple of days. Now, the benefit of these pellets are that it can increase your testosterone, and it creates sort of a stable testosterone for a number of months. Now, each man's a little different depending on their metabolism, but for many guys, this lasts about 3 to 6 months. So I tell guys they'll need it about 3 or 4 times a year. So what happens is we check your testosterone prior to each visit to ensure that the levels aren't getting too high. We also check, as with any testosterone replacement, PSA, blood test to ensure there's no change or change in your risk of prostate cancer. We want to check a complete blood panel to watch your hematocrit or hemoglobin levels. But Testopel is a good option for the right gentleman. Now, what are the benefits of Testopel? Well, like I said, it will generally increase your testosterone, and it maintains it at a higher level for a number of months. Whereas injections, it usually is necessary to give yourself an injection either weekly or every other week, because you get a spike in your testosterone and then it drops. And then you get another spike right after the injection and then it drops. So some men just don't tolerate those spikes in those low levels, and they become irritable with those highs and lows. Testopel might be a good option for those men. In men who are on gels, oftentimes the gels don't absorb well. They don't want to transfer that medicine to their family and kids, which we discuss risk in a different video. And sometimes a gel can be cumbersome. So Testopel in those men also may be a good option. And lastly, some men just don't want to give themselves an injection or use a spray or use a gel. They want to come in the office 3 times a year, get the pellets, and just feel good. And again, that's a good option for a lot of guys who desire an easy and quick appointment and don't mind coming in a few times a year. So how do I do it? Well, If a gentleman comes in and his testosterone is low, we'd assess his symptoms, maybe repeat a testosterone blood test, and I talk to him about the different types of testosterone replacement, specifically gels, injections, and Testopel. I found that those three are generally the more common ways we supplement testosterone. If a man has family members, he spends a lot of time outdoors, shirtless or whatever, gels aren't probably the best bet. If a man is concerned about injecting, he doesn't feel comfortable giving himself injections of testosterone, and he's worried about the ups and downs of the testosterone injectable therapy, then again, Testopel would be a good option. And the biggest hurdle that I found with the pellets is insurance coverage, but in a gentleman with low testosterone, oftentimes it's not a huge issue. And I think it's a very effective way of getting a testosterone up to a therapeutic or desirable level and making it last in that level for a number of months. The procedure in and of itself is very easy for the urologist. Like I said, it takes 10, maybe 15 minutes by the time we wait to let the numbing medicine come in. The incision or a little nick in the skin that we make is maybe 4 millimeters, a quarter of an inch or smaller, and the pellets go in quite easily, and it's not a big deal for most men. Occasionally, you can get a low-grade infection, some swelling, some bruising. Occasionally, a gentleman may spit out those pellets because their body just doesn't agree with them. And if that's the case, you transition to another type of replacement therapy. So again, this is Doc Hepps. Hopefully you enjoy the video. Subscribe to our channel. Make sure you check out the other videos in our library. I appreciate your time. Thanks for watching.